in the newborn infections. Is it clear? When you have newborn infections, I've already explained the tutorial under neonatal sepsis, the mechanism of newborn or neonatal sepsis. When you have neonatal sepsis, mostly as a result of group B streptococcus, and that group B streptococcus that results to infection in neonates, particularly streptococcus agalactiae. Is it clear? Now the third one after group B, after the streptococcus agalactiae, we have streptococcus mutans, and among the streptococcus mutans, you have the streptococcus viridans. Is it clear? Now this streptococcus viridans is the most common cause of the infectious endocarditis, particularly in patients that has an underlying structural heart abnormality. If you have already a valvular heart disease or a congenital heart disease, you can be prone to infectious endocarditis. And this infectious endocarditis is an subacute infectious endocarditis occur in the case of streptococcus viridans, mostly when they have a dental surgery. Is it clear? And now the next one is going to be in the case of the group D streptococcus. For group D streptococcus, you need to understand that the most common in group D streptococcus is going to be enterococci. So enterococci is not an enterobacteriaceae. Enterococci is instead a streptococci, and among the group D streptococcus you have enterococci. Is it clear? So those are the different microorganisms that you have under streptococcus based on the different groups. Is it clear? Now, after visualizing the first aerobes, gram-positive aerobes, the second gram-positive aerobes, now we have the staphylococcus. Is it clear? Staphylococcus. Now, for the staphylococcus, is it clear? They are just meaning that they are cocci, that they are round in shape, and then they are existing in clusters. For staphylococcus, you have the staphylococcus aureus, and you have staphylococcus epidermis. Is it clear? So staphylococcus aureus and staphylococcus epidermis. Now we need to know that what generally staphylococcus aureus and staphylococcus epidermis, all of them are divided into two. We have the methicillin sensitive staphylococcus aureus, and we have also generally, this is particularly for staphylococcus aureus, the division of staphylococcus aureus. Staphylococcus aureus can be divided into two. We have the methicillin sensitive staphylococcus aureus, and we have the methicillin resistant staphylococcus aureus. Is it clear? And you need to know that there are significance for all this, and I'm going to tell that when I'm going to speak about the class of the medication that is going to be used for each of them. Is it clear? So now here is just for you to understand the classification. Now the next thing after that, the next thing after that, so we are finished with streptococcus and staphylococcus under the gram-positive aerobes. Is it clear? So under the gram-positive aerobes, those are the two major ones. Now we move to the next one, which is the gram-negative, the gram-positive anaerobes instead. The gram-positive anaerobes. Is it clear? Now in the case of the gram-positive anaerobes, you have what is called the Clostridium family. Is it clear? All the Clostridium family is under the gram-positive anaerobes. Is it clear? For the Clostridium family, we have the gram-positive anaerobes. Now, under the Clostridium family, we are going to have the first one, Clostridium tetani. Is it clear? Clostridium tetani is the one that causes tetanus. The second one, we have Clostridium botulinum. Is it clear? Clostridium botulinum is the one that causes botulinism, that is paralysis after eating the food of Clostridium botulinum. The next one, we have Clostridium difficile. Is it clear? Clostridium difficile is the one that causes enterocolitis, bloody enterocolitis most of the time after taking excessive broad spectrum antibiotics. So if you have a patient that takes excessively broad spectrum antibiotics and then you start having bloody stools, Is it clear? With blood enterocolitis, most of the time caused as a result of Clostridium difficile, and that Clostridium difficile results to what is called peculiar bloody enterocolitis called pseudomembranous colitis. It is called pseudomembranous colitis. The fourth one after Clostridium difficile, we have Clostridium perfringinis. Is it clear? We have Clostridium perfringinis, which is the cause of gas gangrene. Is it clear? So those are the different etiologies under the gram-positive anaerobes. Now, after visualizing those gram-positive anaerobes, I may put in other terms. So I don't know. So under the gram-positive anaerobes also, we have the second one after that, the Clostridium. We have the Listeria monocytogenes. Is it clear? Listeria monocytogenes. Listeria monocytogenes is a gram-positive anaerobe, peculiarly a gram-positive coccobacilli. Is it clear? So if you have gram-positive coccobacilli, it is Listeria monocytogene, and there are anaerobes. Is it clear? So when you are looking them on a microscope, you're going to see gram-positive coccobacilli, and there are anaerobes. Is it clear? So Listeria monocytogene is also there. Is it clear? So those are the different things that you have to visualize in mind. So when you are understanding the gram-positive, the gram-positive anaerobes. Now, after visualizing the gram-positive anaerobes, you now move to the next one, which are the gram-negatives. Now, for the gram-negatives, you need to know that the gram-negative is divided into two. We have the gram-negative anaerobes. We have the gram-negative first aerobes that we're going to start with, and we have the gram-negative anaerobes. Is it clear? So we are going to start with the aerobes of the gram-negative. So for the gram-negative aerobes, the first element that you're going to have under the gram-negative aerobes, so we are going to visualize that in the next tutorial for the gram-negative aerobe.